and good evening to all the people watching us on Unimo Universe of Moms and also on Pink of Health page. I hope you see us live and I'm clearly audible and visible to you. I'll wait for few of you to join in. Give me some thumbs up so that I understand that everything is going fine. Okay, so I'm waiting and I can see a lot of you joining in. Hello, 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 everybody. Hello, good evening. Okay. Please tag in your friends to join in this very, very, very informative live. I know that you guys are waiting for this live since the time we've rolled out the posters. Okay, so I'm waiting. Oh, I can see a lot of you already joining in. So, without really wasting any more time, let me tell you, mothers, that ऐसी एक information जो शायद आपको नहीं पता है. Do you know 7 out of 10 children in India suffer from IDA, which is iron deficiency anemia, and it is not just the thing, it is also that this deficiency can impact the overall development of a child. तो सबसे पहला क्वेश्चन हम सबके दिमाग में आता है कि आर आर चिल्ड्रन आयरन डेफिशिएंट, या हमारा आयरन लेवल ठीक है, हमें क्या प्रिवेंशन लेना चाहिए, क्या प्रिकॉशंस लेना चाहिए, व्हाट आर द थिंग्स टू कीप इन माइंड व्हेन वी टॉक अबाउट आईडीए. So to talk about this subject, I've invited two esteemed guests to our panel today, and I'm quickly going to introduce both of them to all of you mothers, but I'll request all of you to stay tuned. Tag your fellow moms, tag your fellow daddies, because all of you will find this live super insightful. This live is powered by Pink of Health Initiative, which is an initiative by CIPLA, and of course your community Unimo Universe Moms. So here I have two amazing pediatricians with me, Dr. Shantanu Dutt, who is a consultant pediatric and neonatal care. He's from Moradabad, Uttar Pradesh. Wow. Hello and welcome, Dr. Dutt.
Hi, everyone.
Next, I have with me Dr. R.S. Sethi, a very senior consultant pediatrics from Jhansi, Uttar Pradesh. Wow. Hello, Dr. Sethi. Welcome.
Hello, how are you all? Good evening and welcome to the show.
Good evening, sir. Good evening, sir. And sorry to all our viewers who were kept waiting for 5 minutes. There was a little technical glitch that delayed us for 5 minutes, but here we are. So, mothers, we all want to protect our kids from everything, but now it's the time to protect them from IDA too, iron deficiency anemia. And today in this live, we are going to discuss much more about this topic. Let me start with my first question first. I'll go one by one. I'll definitely ask both the doctors to give their views on certain common questions, but I'll also go one by one to each of you. But my first question, doctor, is a very common question, and you can choose who wants to go first. I think all the mothers who are watching this live want to know about the common symptoms. When do you suspect that your child is suffering from IDA? Or when can you, call your child anemic? What are the red flags we should watch out for? Dr. Dutt, you want to go first?
Yeah, why not? Actually, I would recommend my senior Dr. Sethi to start now. He's like the
sure.
senior one.
So, Dr. Sethi, please, sir.
Okay, thank you very much. It's a very pertinent question you've asked, madam. And the most important thing is it depends upon the severity as well as the development of anemia, which tells us about the symptoms of the disease. And the most important symptoms are that the mother comes with us if the child is becoming very pale, and the lips are becoming pale, the tongue is becoming pale, the conjunctiva is becoming pale, and the hands and all, they are becoming pale. And as a result of that, the child, because of pallor and so many other things along with that, the child becomes very irritable. Child doesn't eat at all. Mother say the child is not eating at all. Khana nahi kha raha bilkul. Child has fatigue in the evening, a lot of cramps in the evening. And of course, as the anemia progresses, so many other organs are also involved with that. A very important symptom is pica. Pica is the consumption of inedible objects like clay, like mud, etc., etc. And so many terms are given to that. I would not like to go into the detail of the various terms. It is geophagia, it is phagophagia, that is eating rice and all that. So these are the symptoms which the child usually has. Plus, when the anemia becomes greater, what happens is that the hyperdynamic circulation takes part into consideration, and the child has palpitations, the child has breathlessness, the child has effort intolerance, and the mothers say that the child will not work at all, is not happy, moving around in the crowd. or moving it at home due to certain cause in the house. Plus, the other tissues may also be involved in, anemia, like the brain. So the child will have loss of concentration, loss of memory, and scholastic performance is going to decrease hell of a lot. So these are the signs which maybe the parents are able to tell the doctor, and that is where we have to investigate the child. Thank you.
Yeah, Dr.
Wonderful.
Dutt, your views on it. I think
Yeah.
Dr. Sethi covered very pertinent points, and I think we'll just go a little bit more on these. Yeah.
So wonderfully said, Dr. Sethi. All the symptoms and signs are there. So more important than that, it is very important to know, as you had said, I want to emphasize that 7 out of 10 children in India are anemic. That means their hemoglobin is below the normal value, 70%. That is irrespective of your socioeconomic status, whether you're living in a village or in an urban environment. Sadly, about 1/3 of the children in all of India are receiving age-appropriate foods. So they're not receiving proper nutrition. And it is sad to say that in a country which is developing so well, we still have a anemia, which is just because you're not taking proper nutrients. It is iron deficiency anemia because of the deficiency of iron. And as Sir had said, before anemia presents, iron deficiency is there. And it is very important to understand that if you can just like extrapolate that 70% of children in India are iron deficient, are anemic, iron deficient anemic, how many children are iron deficient? Not anemic,
I think
but iron deficient.
yeah, much more than that. Then.
It is we don't know the exact studies, but it is said that about 90 to 95% are iron deficient. And it is very important to know that hemoglobin is manufactured by iron, and iron is important for manufacturing of hemoglobin. But hemoglobin and iron relation is the least and the last one. So before that, what comes? Immunity, your brain development, your cognition. So all these things starts getting damaged and hampered even before anemia settles in. So if your child, as Sarat said, even before you see that the child is pale, even before you see that the child has developed pica, is eating unnatural foods, eating like the paint papdi, eating raw rice, eating raw atta, even like sometimes eating soil. So those things develop later on, but even before that, what happens is the cognition goes down, the performance in school goes down, the child will start having recurrent infections. If your child is having recurrent infections, even if the hemoglobin is normal, you should be worried about iron deficiency. If your child performance in school is going down, he's becoming very cranky. A lot of parents come to me with just that the child has become cranky. The child is not very irritable. My child was the most lovable boy in the class, and now teacher complains that he's fighting with everybody. He's like crying a lot. Even in the class, even in the home, we find that like small things trigger him. So whenever you have these things, we should be worried about iron deficiency. And it's very easy. You go to your doctor or even do a simple pink checkup. You are having that on the website, on the Facebook only. You can do a pink checkup and you can see a lot of questions were, is your child irritable? Is your child not eating properly? Is the child cranky? So if all these are things, you should always consider the child might be anemic and visit your closest doctor.
Okay, great. I think both of you have summed it up very well, and I'm sure all the people who are watching us have got a lot of inputs there. Doctor, my next question is, a bud from your answer only, Doctor, that you were talking about hemoglobin levels. What exactly is the ideal hemoglobin levels? How do you diagnose the same? Like, what is the process?
That's a very good question. So before that, it's very important to know that children are not young adults. Okay, so we have different age groups, and different age groups will have a different normal hemoglobin level. So I will give you an example. For a newborn, it is very normal to have a hemoglobin level of 20 or even 22. It's normal for him. But as the child grows, the hemoglobin level drops slowly. And it is said that if you are around a hemoglobin level of around 11 to 12 is normal. So we want ideally 12 or above for both girls and boys. So anytime it starts dropping, we call it anemia. And definition would be that anytime it is below 10, it is clinical anemia. Then it is obviously classified into moderate, mild, moderate, and severe. And as Sarat said, that whenever it is mild, it will only have symptoms which are irregular symptoms. Pica could be there, like craving for unnatural foods. Second, it could be crankiness, the performance going down. But as the hemoglobin level starts dropping, the other problems keep up. Like even in severe anemia, you can have dilatation of the heart. The child can have spells. We call it breath holding spells can also happen, in which the child actually stops breathing for a while and turns blue. That can also happen. So anemia is very important. But we know, like whenever this happens, all parents will go to a doctor and will get it diagnosed. The purpose is to catch it early, and even more important is to prevent it. We are, because anytime a patient, a child comes to me or sir or any pediatrician, they will be able to easily identify anemia. It is very easy for us, and we can easily start the treatment. But we are here to educate the parents so that we can actually prevent anemia. You can imagine, like 7 out of 10, you can just randomly throw a dice in the number and it will be like the child is anemic. So if you have 10 children in the room, you can say, okay, 7 of them are anemic. So it is very important. We prevent anemia, not treat anemia.
Indeed, I understood your approach to this, Dr. Sethi. My next question to you is around the causes of iron deficiency. Basically, as mothers, we all know that diet से तो बहुत फर्क पड़ता है. But what are the other causes of iron deficiency apart from diet?
Well, of course, as you said, diet is the most important thing which causes iron deficiency anemia. But the diet is okay, but there has to be good absorption. If there's no absorption in the intestine, what is going to happen? The iron is not going to be absorbed and then not utilized in the body. So if the child is having intestinal infections, if the child is having helminthic infestations, that is worm infestation, if the child is having gastrointestinal infections and diarrhea, then it is not being absorbed and iron is not being taken into the body, in the blood, and the child is going to be anemic. There can be blood loss because of which the child may have anemia. Then, if you add on to a lot of milk, a number of times the parents come to us and we've diagnosed it as a case of anemia. मेरा बच्चा anemic नहीं हो सकता, मैं तो इसको इतना दूध पिलाती हूँ, 2 किलो दूध पी रहा है, 3 किलो दूध पी रहा है. I said, what the hell? So, you're just adding on to milk, and that is lowest in the iron. So, what is going to happen is that the child's nutrition is compromised and the child becomes anemic. Right? So, these are the important things. Plus, infections like, diarrhea, that's very important. Chronic diarrhea can give
Yeah.
rise to, lack of absorption. So, these are the important points which I like to say regarding the etiology of anemia.
I'm so glad you touched upon a very, very common myth of our country. And I think I have to do some myth busting with both of you in the end. And I'll definitely ask you some more questions, because a lot of us believe in these WhatsApp forwards and, Facebook messages and do not really go to an expert, which as a platform we always, are anti against. Though we are a Facebook-led platform, we always want and advocate our mothers to go to doctors, go to their respective pediatricians and go and refer to them when it comes to questions like these. Doctor, my next question is also to you, Dr. Sethi. You talked about worm infestation, and I think I am also a mother of twin boys, and I've done a lot of worm infestation for both of them, and we have done it annually. When they were young. So, is annual deworming of child necessary, especially in a country like India? Because I've heard both the sides of it. So, I just want to know from you, sir.
Especially, I like to say that helminthic infestations or worm infestations are a huge problem. It's a big burden for the children. About 2.5 million preschool children and school children are suffering from helminthic infestations. So it's a huge problem. Therefore, it is paramount importance that we deworm the child at least twice annually. 6 monthly has to be done. And what the parents do is that they keep on deworming the child after every 10 days, 15 days. मैंने अभी इसको दवाई दी थी, मैं फिर से दे रही हूँ, because the child is still having irritation in the perianal region. So it should not be given so frequently. The ideal is, the dictum is that you biannually give deworm. And there's a program going on with the government. I don't know the name of the program at the moment, but there's a program going on in which the school children are given, these deworming tablets twice a year, so as to, decrease the incidence and prevalence of the disease.
Okay, so I think that was a wonderful information, and I'm sure mothers now ज़्यादा कम कुछ नहीं, only by a year, यानी साल में सिर्फ 2 बार. Okay, that's the recommendation. Dr. Dutt, I have my next question for you. Uh, what are your views on oral iron supplementations? Do you recommend them? And if yes, what is the frequency for those?
So yeah, before this, we need to know what are the normal iron requirements for a child. So this is also very variable. So a child who is a newborn will need a different amount of iron. The requirements are higher, and as the child grows, it drops. If a child is premature, then also the iron requirements are higher, because as we have more and more children, because earlier it was very common for a child to be born with 3.5 kg and above. Now more and more we are seeing children like almost I'm very sad to say that, but 2.5 and 2.6 are becoming normal now. So okay, my child birth weight was 2.5 kg, which is
Like
not
I'll tell you, doctor, that I delivered 16 years back, and my boys, I had twin boys, and they were 2.25, 2.5, which I think was a very healthy, good weight for twin boys.
yeah.
So
For
I think,
twins,
yeah, it's very,
actually, yeah, exactly. For twins, it is actually a good weight because it's actually getting divided. And as you had
yeah.
mentioned, in twins also, the iron requirement, actually, we need to start iron early, because mother's iron,
Okay.
the mother giving iron is actually divided in two children. So their iron requirement, their iron stores are already low and they will deplete very quickly. So they will also need iron early in life, and oral iron is the best way to cure anemia and prevent anemia. So as I said, first of all, very important is the nutrition. The child should receive proper nutrition. As you had said, what are my views on oral iron therapy? Any child who comes to me with anemia will get oral iron therapy and will get okay. Beyond that, before that, it is very important that we do not reach to a level that the child has to reach to the doctor. So the nutrition is very important. And what is happening right now is the nutrition is lacking. More and more, as Sir had said, milk is now becoming of paramount importance. So milk is okay if you are giving in a very moderate quantity. Like a child 2 years receiving about 100 to 200 ml of milk is okay. But when it becomes 2000 ml, it becomes a problem. So much of milk in the body will actually prevent any iron from getting absorbed. So even this child who's consuming 2 liters of milk a day, even if I'm giving him iron, it will not be absorbed. So we need to have proper nutrition. The parents needs to be educated that what are the healthy things we should eat and what are the things we should be away from. And I am seeing this trend, dangerous trend of westernization. So earlier, if the child wanted to eat something sweet, उसको यहाँ पे गुड़ का हलवा बना के दिया जाता था, which is good. देसी घी है, गुड़ है, सूजी है, all good. Now, sadly, whenever a child says he wants to eat something sweet, it is 99.9% something processed. You buy something and the child takes it. It is nothing which is prepared at the home. It is not natural things which are being used. And this is which is causing a problem. The children are moving towards more Western fast food diet, processed food, and this is causing iron deficiency anemia and also other deficiencies also. So we need to be very careful in improving the nutrition of the child. Along with this, yes, the children need iron. If your child is born premature, you will start iron as early as possible. Even before, like I would say, like even before like 10 days of life, you will be starting iron in a premature child. A child who is born less than 2.5 kg, I will start iron very early. Any child who has recurrent infections, I will do an iron level and I will start iron very early. Children who are malnourished or who have low body weight, nutrition is compromised, I will start them on iron therapy. So these all children need iron therapy, and it is very important to give them.
Great, doctor. That I saw that you mentioned about little babies. You also talked about premature babies. Dr. Sethi, my next question is to you, and I'll take a step much before Dr. Dutt also, and I'll talk about pregnant moms, because we have a lot of pregnant mothers on our community, and they are also watching this live. I want to understand from you, doctor, that if I have to take, I have to give certain tips to mothers, that what care can be taken right from pregnancy, and such that they can avoid IDA in future or in their future child also, as well as in the mother. So what are your advices there, sir?
This is for
I
me.
think I'll be a step.
Dr. Sethi,
Sorry.
yeah. I'll come to
Yeah.
you, sir. Yeah.
I think I'll be a step further than you. First, I like the mothers to have a better health, before pregnancy. That is more paramount importance. That
Wow.
the mother is, healthy, is having a lot of rest, having good nutrition, and all his systems or her systems are normal. And thereafter, we have to see so many factors, in the pregnancy. We divide the pregnancy into three terms, the first trimester, second trimester, and third trimester. In the first trimester, it is it is the period of organogenesis. That is, the organs are being developed, and there are certain things like infections, like drugs, like irradiation, which is going to harm the fetus organs, and the child is going to have congenital malformations. Right. In the second trimester, it is a period of growth. That is, the weight is going to increase. The organs are being formed in the first trimester, and the weight is going to be increased in the second trimester. That is in which the mother should be healthy as regards the heart is concerned. There should be no hypertension. The blood pressure should be normal. The diabetes should be controlled. The mother should have good nutrition. The thyroid has to be looked after and fixed up, because all these things can give rise to low birth weight. When once the child is low birth weight, there's so many complications of prematurity and low birth weight occur. So in pregnancy, we start off with folic acid initially. Iron has to be started in the second trimester, and we have to see for nutrition of the mother. The calorie content is 300 more than what the normal requirement of a female is. Protein is even more. It's about 60 grams per day. Calcium has to be given, vitamin D has to be given, fat soluble vitamins have to be given, and uh, the this thing, vitamin B12, B6, they're very important as regards the development of the fetus is concerned. And the types of foods the mother should have are the vegetables, fruits, dairy products, protein. You can have non-veg if the mother is non-veg, so that you avoid getting deficient in so many things, precisely iron, which can give rise to iron deficiency anemia in the mother. That is to prevent that's prevented. Otherwise, you have so many complications going round.
So,
I would like
so
to add. I would like to just
yeah,
add.
yeah,
Yes, that
I
said.
wanted you to
Uh,
add. I wanted you to add on to this, Dr. Dutt, and you can also add one more, answer there. What I want from you. So this is month is a breastfeeding month, and we all are celebrating it. I had someone live on the first week around breast milk, and we all think that breast milk to newborn ke liye sufficient hoga. So if you can also touch upon that point, that for IDA also
yeah.
is breast milk sufficient? Yeah. Yes, sir.
So as Sarit said, that pregnant mothers need iron. It's very important. I would go even a step further. I would say even before you're planning to get pregnant, the iron should start, because the
I think
iron
Dr.
store.
Sethi started with that
Yes.
only, saying मैं
Yeah.
आपके भी आगे जाता हूँ, and I'll talk about that. I think you both are touching upon a very very relevant point. That
So
are we
iron
taking care of
requirement.
ourselves before planning? Yeah.
Exactly. So iron requirements are much higher in girls than boys. So even if you go for a child like say around 14 to 18, the age the girl starts menstruating, her iron requirements jump from 10 to 15 the day she starts menstruating. And above 19 years of age, the iron requirements jump to even 18 per day. So you can just imagine from a child, like from a child about like 18-year-old boy will need about 8 milligrams will need 8 milligrams of iron per day. A girl would need 18 milligrams of iron per day. So this is for her to be ready if she gets pregnant later on, because this iron will be delivered in form of the iron stores to the child who's delivered. And then after, when the child starts receiving breastfeeding, the iron will be delivered from the breastfeed. Yes. If the child is born, as we had covered, more than like 3 kgs, the iron requirement from the iron delivered from breastfeeding is sufficient. The child will not need any iron till 6 months of age. You can be not worried. The God has made it so nice that till 6 months, nothing is required for this child. The child will be very good. The baby is very good just with mother's milk. Not even water is to be given. We now know that the one thing even children who are breastfed is vitamin D. So vitamin D we give starting at birth. We give vitamin D to all children, irrespective whether they are breastfeeding or not. But in a normal child born by a normal delivery, and receiving exclusive breastfeeding, I am not worried about any iron deficiency till 6 months of age. And we see it very often that iron deficiency normally does not appear. And sir would agree with me that if iron deficiency appears in a child who's 2 months, 3 months, or 4 months, and the child is on breastfeeding, we always look for something which is unnatural. We are sure that it is not iron deficiency anemia. This anemia is pathological and it has some because of some other problem, maybe thalassemia, maybe some other problem, not iron deficiency. Very unlikely. A breastfed child will not have iron deficiency anemia. But what problems happen is after 6 months of age. I have seen children who are growing. We always do growth charts on children whenever they come to visit us. The growth charts are perfect. The child is growing. The head circumference is fine. The length is fine. The weight is gaining is perfect. The moment 6 months happens, there is I don't know, that's miscommunication by us or we need to do something about it. The parents think that now the 6 months has come, it is a time to wean the child. And I always say that weaning is a very wrong word. Weaning means to put away, to remove. And what parents do is they remove from breast milk and go to cow's milk. That is completely wrong. Cow milk is made for cows, whatever you can say, the calf. Human milk is made for human. गाय का बछड़ा जो है वो लिटरली एक दिन के अंदर खड़ा हो जाता है, विद इन फ्यू आवर्स खड़ा हो जाता है, चलना शुरू कर देता है, नीड्स वेरी हाई प्रोटीन. Human milk is made for a human. Human milk has lot of fats in it, which are essential for development of brain. The human child will start walking on two legs, will start speaking, will have cognition, will have understanding. The brain development is very important. And for that, it is very important the mother milk should be given to the child. And at 6 months, do not stop mother milk. Do not reduce mother milk. Do not start cow's milk. You start complementary feeding. You start feeding the child extra things. And whenever this is damaged, the child is not receiving proper complementary feeding. The food is not giving properly. We just shift from mother's milk to cow's milk. The child will definitely develop all the nutrition deficiencies, including iron deficiency, and will end up in iron deficiency anemia. And these kids, we need to give iron. Not all kids.
In fact, I'm sure we all learned about the pregnancy to 6 month cycle because you clarified every single point there. Dr. Sethi, if I ask you,
I'd just like to add one.
I was coming to
fantastic.
you.
It was fantastically said by Dr. Datta regarding the whole cycle. I'd just like to add that there are two stages in the pediatric age group, that is prematurity, and second is adolescence, puberty, where the requirement of iron increases. And that is the period when the deficiency occurs, as Dr. Datta has said. And actually, we calculate the iron requirements as 2 to 6 milligram per kg body weight. According to the body weight, we add the total irons, and the ferrous iron is the one which is the iron which is to be given for better absorption rather than ferric iron. So I just wanted to add the rejoinder, but he has really explained the whole thing very well.
Yeah, I'm glad. I wanted to come to you, in fact, on a similar point, and you touched upon it, doctor. I have a question for both of you. In fact, if both of you can throw some light on it, how exactly IDA can be prevented in children? Because I think that's the question we all have been talking about it. In fact, Dr. Dutt started his conversation by saying, "Pehle prevention zaruri hai, doctor, early detection zaruri hai, and then only you can take care of it." या फिर if you have to give some IDA prevention tips to the parents who are watching us right now, what will be some tips from both of you? Dr. Sethi, you want to go first?
I think the tips have been given rightly by Dr. Datta when he told us about the premature babies and all that, and starting off the iron requirement right from the very beginning. So you have to really, and the term that you used was exclusive breastfeeding. Why are we giving exclusive breastfeeding? Because the child's intake, child's requirements, every requirement is adequately met by breastfeeding till 6 months of age. So there is a term known as physiological anemia. Physiological anemia, which occurs at about 3 months of age, in which is a dip not because of iron, it is because of physiological problems in the child's hematopoietic system. So what is this?
Yes, sir. Sorry for the. No problem, sir. You're audible.
Dr. Datta can take over. It's the problem here.
Okay.
Yeah.
So I would say like as I had said that till 6 months of age, we are not worried. If the child is receiving proper mother's milk, it is sufficient. The problem starts at 6 months. So what should we do to prevent this at 6 months?
Yeah.
At 6 months, starting a proper complementary feeding is very important. Complementary feeding does not mean giving cow milk. Complementary feeding means giving very good iron-rich foods. Whether you are a vegetarian or a non-vegetarian, iron-rich food can be given to a child. A food which is very good in legumes. Anything, I would say very simple. Chole, chane, rajma. So these are very good. Not at 6 months, but like later on, these are very good. Second would be giving all green vegetables to the child. Broccoli. Earlier, broccoli used to be one thing which was only available in Delhi and big cities. Now I find people coming from villages. They're saying, can we give our child broccoli? I said, आपके पास broccoli होती है, हम खुद ही उगाते हैं. So I said, okay, so you can give broccoli. ठीक है ना? So that is happening. So green vegetables, spinach is very good. Like say, how can a child have, a small child can have spinach? I have seen mothers who are preparing spinach-based diet for a child. I'm saying, very good, like give that.
Yes.
It's
We
perfect.
can really hide our spinach in various recipes and give it to our children. Yeah.
Yes,
My,
I've
my
seen.
daughter-in-law is
Yeah.
my daughter-in-law is adding spinach every day. Every day in her child's diet. And she grows it at her own place. That is
Perfect.
so much of
Wow.
that's not conscious about adding green vegetables with that.
Nothing
And
like
And
as you
that.
and
Yeah.
said, broccoli was said to be so expensive earlier on and out of the reach of common people, but now everyone is taking it, as Dr. Datta said. So these are the things which have to be added on to that is complementary feeding has to be given adequately to prevent iron deficiency anemia.
yeah. And
Perfect.
as the child
So,
starts growing up, I would say it is important to have a proper way of eating a food. What I have
okay.
noticed it that like okay, my child is always eating junk food. The parents are complaining. ये तो सर हमेशा कोल्ड ड्रिंक पीता रहता है सर ये तो हमेशा टॉफीज खाता रहता है तो मैंने बोला घर में बाजार से लेके आता है आप रखते हो घर में कहते नहीं सर वो तो हम रखते हैं समटाइम्स द चाइल्ड विल कंप्लेन कि सर ये पापा भी पीते हैं रोज कोल्ड ड्रिंक मैं क्या कहूँ उनको तो मैंने बोला कि
True.
इट इज वेरी इंपॉर्टेंट टू बी द रोल मॉडल in the house. Do not have stuff lying around in the house. Do not have junk food lying around in the house. These are all empty calories. They only have sugar and salt and chemicals. They can fill up your stomach. They can fill up your hunger. But the hidden hunger remains. What is hidden hunger? Hidden hunger is the lack of micronutrients. You're not getting iron, you're not getting vitamins, you're not getting proper nutrition. So these micronutrients are lacking. And we need to go back to eating natural home cooked food. That is perfect for the child. Sometimes, okay, if you're going out, watching a movie, someplace out, okay, enjoy yourself, eat something outside. But these should be foods which are meant to be eaten once in a while, but not daily. And if we
So
have that,
if we
we
are
can easily
talking about
prevent iron
food,
That
deficiency anemia.
is, I
yeah,
would
I'm
add
sorry
to
for
that.
jumping in.
That
I'm
is
sorry for
known as
jumping in, but I just wanted to understand from both of you because you're talking about diet, you're talking about vegetables, you're talking about healthy food. There is a myth, or I don't know if it's a fact, that you're more prone to anemia if you're a vegetarian. Like I come from a household which is vegetarian. So is it true, sir?
I would just ask you a question, which is the, okay, India is the most, has the highest population of vegetarians in the world. I would like to ask, which is the second country with most vegetarians in the world?
Second country with most vegetarians
India
in
is
the
first,
world.
we know
Is it?
that. It is Israel.
Yeah.
Israel,
Oh,
if you go by percentage, it has the highest population of vegetarians in the world after India.
oh, okay. Oh, that's
But
news to me.
so
Okay.
but they don't have anemia. It's not like vegetarian and anemia are cross-linked. So if it is like the first country has it anemia, then second country should be anemic also. They don't have anemia at all. It is when what you are consuming. If you're consuming legumes, lots of dals, lots of rajma, chole, chane, if you're taking lots of green vegetables, if you're eating lots of good fruits, your nutrition is good. If you go and see, they have, I don't know what it's called. It's made by chickpea and it is known as hummus. Hummus is very common.
Yeah.
They eat hummus a lot and it is so nutritious. It has a lot of iron in it. It has a lot of protein in it and good vegetarian protein. So it is very important not to have this disbelief that, okay, if you're a vegetarian, you will have iron deficiency. But there is a very huge linking with the consumption of milk and iron deficiency. If you're consuming too much, it's very common. Whenever we are prescribing iron, We know it on the back of the head. It is like spinal for us. We don't even think about it. आपको iron देना है, iron देने के साथ milk नहीं देना है. It is like just
तो सर
comes to us.
मिल्क की बात कर रहे हैं तो मेरा एक क्वेश्चन तो डेफिनेटली बनता है जो आई थिंक इज अ क्वेश्चन आप सबको बहुत ज्यादा सुनाई दिया होगा. डज काउज मिल्क cause iron deficiency in children, Dr. Sethi?
Actually, cow's milk, is deficient in iron, and the bioavailability of iron is also poor in cow's milk.
Oh,
And it
okay.
also, if cow's milk is taken in a greater amount, it decreases the absorption of iron from the other foods also. So that is why we say that cow's milk should not be given in infancy at all, because the volume is increased, but there's decreased bioavailability as well as deficiency of iron in the cow's milk. So that is, I think, the answer to your question. I would just like to add one thing that
Sure, sir.
before this we were discussing about things which the child should not take, the fast foods. But there's
Yeah.
now called a cheat day, in which one day is left for the child to
Yeah,
have everything
you're
that they
allowed
want
to
to
eat
have.
whatever you
Otherwise, they are going
yeah.
to throw temper tantrums. If you refuse these foods every day, then they're going to have a lot of temper tantrums and fighting at home. So it's better to ask them to say, okay, one day it's a cheat day. You can take that particular day. We also tell our patients, एक दिन तुम खाना खा लेना उसके बाद बाकी नहीं मिलेगा. So they're at least happy, that they're going to get it.
I
What
think
we
all
do
the
is
mothers will. I think
exactly.
all
So
the
what we
mothers will
do
love you,
in
Dr.
this,
Sethi.
what we
For
do in
the
this only
cheat.
the cheat day would be, it should be used as a reward. It should be a
Yeah,
used
not
as a
as
reward.
cheat.
Okay.
It should
हाँ,
not
we
be
should
called.
call it a reward day, and we say, okay, your child has been studying all day, he's doing all his hard works, he's doing work at home, just like chores. Earlier time children used to do, now they're not doing it. It's only mobile TV. We want like, okay, you're helping in cleaning the house, you're doing this and everything, you're helping putting away the dishes. If you're doing all these things, and we should appreciate it, even if they're not doing it, appreciate it and say, okay, आपने इतनी help करी, आपने अपने school का homework किया, आप सब कर रहे हो. Let's go out on a Sunday. We will all eat out and have good food, and even we have like junk food, it's fine. Then it is a reward. The
Yeah,
problem
I
is it
think,
is
Dr. Dutt,
becoming
I'll
something
give you.
completely opposite. The child is like now fighting. Why can't I have a cold drink? Because now it has become an everyday thing. And the child gets angry when you just take it away. Okay, nahi, because now the child is used to having cold drinks and junk food every day, and now you take it away. So we should have a reward system. And as for cow milk, I have 3 things which are very important. Cow milk inhibits absorption of iron. Cow milk can actually cause micro bleeding in the gut, which can lead to iron loss from the gut. Yes, the cow milk can actually cause micro bleeding in the gut, which will lead to blood loss, micro blood loss, and then finally leading to anemia in the child. And third is that the cow milk, what it does is it actually prevents any kind of iron being absorbed. It actually lines up the gut and prevents any absorption from the natural diet also. So if you have a natural diet which is lacking, actually the milk is low in quantity, it is perfect. But if the moment you go higher than 2 glasses of milk a day, or even like a large glass of milk a day, it becomes a problem.
Okay.
Many
I
times
think
cow's milk can.
Yes, sir.
Many times
Yeah.
cow's milk can give rise to hemorrhage also, and that is the reason we've got to stop it because of cow's milk allergy, that as Dr. Datta said. So that is why one reason is also there of taking cow's
Okay,
milk.
so my next question is around the health drinks. Like nowadays, we have so many health drink options available commercially, which claims to contain iron. Are they enough to prevent iron deficiency anemia in children? Because we're talking about it, and they are the easiest solution we all find around us. Dr. Sethi, what's your view on this?
I wouldn't say much about it because I don't think health drinks are going to give any help at all. Not at all. I will not advocate any health drinks for the children at the moment.
Okay.
I don't
Health drink
want to
should
give a
always
wrong.
be put on quotes, health drink. So they don't do anything about health at all. It is just a way of making commercially made product so that the moms and the parents don't have a, what do you call it, a lack of conscience ki, okay, at least my child is drinking this weird thing which has so much sugar in it. Okay, kitna iron hai, theek hai, but sugar calculate karna important hai. Sometimes, like if you're adding 3 scoops mein 1.5 scoop to sugar hi tha. So you're just overloading your child with sugar, and because it is tasty, the child will drink it, thoda sa iron jayega. It's very important to see what we want to give. That's what I say. Start moving away from processed food. The Western countries are doing it now. But what we are doing is following the Western countries, the mistakes they were doing in 70s and 80s. Yes. So they are now moving away from it. So it is important that we should actually not do that thing. Exactly.
Though we are, I think we as Indians are blessed to have that in our culture and in our diet, from earlier time. So my last question to you, and then I'll take one or two audience question. We talked about iron deficiency anemia, and we also talked about iron supplements and different food which has iron rich foods. Is iron alone enough, or there should be other vitamins also added to the diet, like folic acid and all? What's your view on that? Dr. Sethi, you want to take it?
Yeah, of course, you got to add on to so many things, as I said earlier on, that all the
Mm-hmm.
micronutrients, the vitamins, the fat soluble vitamins, the B complex vitamins have to be added along with that, because the nutrition is in totality. It's not just iron deficiency. It's a totally, the calories are to be met with, the proteins have to be met with, the fat has to be met with, and that is the total the total amount of the calories which the women take, that will account for the iron deficient mother. So you don't consider the iron only. You have to consider the whole nutrition into consideration when you decide about the iron deficiency anemia.
So there was a
Okay, great.
study done by this Ministry of Health and Family Welfare, in which
Okay.
they did a study and they found that iron can be used as a proxy marker for other micronutrient deficiencies. So they did found children who were having low iron, and then they tested for other micronutrients. They found they were lacking in vitamin B12, folate, vitamin D, zinc, iron. They were all lacking in those. So a child who's having iron deficiency anemia or iron deficiency per se only will have high chances of having all these problems also. So
That is what
that's
you
why
said was hidden.
it's very important that we treat iron deficiency early, but treating just iron deficiency is not important. Taking care of the whole nutrition of the child is very important. And one thing, as I was talking about studies, it's very important. We do a national family health survey every 10 years. And
Yeah.
what we were finding in this is that every 10 years, the level of anemia in India was going down. So the last family health survey was a National Family Health Survey done in 2015, which was National Family Health Survey 4. Now we did a
Four.
number, 4. Now we did number
4.
5. This is the sad part, and it should raise alarms and red flags that first time ever the incidence of iron deficiency anemia is rising. अभी तक तो गिर रहा था, पूरे इंडिया में आयरन डेफिशिएंसी कम होता जा रहा था. We were improving, but something happened in the past 10 years which led for increase of iron deficiency anemia. So if something is happening wrong, which is increasing the iron deficiency anemia all over the country. So it is very important for parents.
If I'm not wrong,
sure.
the incidence is about 58% nowadays.
Yes,
58% women are, iron deficient in India itself. So that is
yes.
what Dr. Shantanu is saying, that it is increasing. So it is one of the highest as compared to the other countries.
Out of 10, 6 mothers are iron deficient. Out of 10 children, 7 children are iron deficient. And it is very important. India is such a good country. We have such bright students. If you look at the CEOs around the world, go into the Silicon Valley. Microsoft, Indian.
Indians.
Google, Indian. Adobe, Indian. Other also is Indian. So many Indians are CEOs. You can just imagine कि कितना potential है India में कि even with iron deficiency anemia being 70%, हमारे बच्चे इतने bright हैं. Just imagine if we can prevent iron deficiency anemia and iron deficiency, what will their cognition level will be? What will be their mental level? Their IQ point difference is approximately 4 to 5, and 4 to 5 लगता है बहुत कम है, but 4 to 5 is like from being topper in the class to being 20th in the class. You can imagine कितना difference हो जाता है 4 points से. Second would be, it has been calculated and made consensus has been made that you can actually tell कि ये बच्चा जो है बड़े होके कौन सा कैरियर होगा इसका, ये कितना कमाएगा, जस्ट बाय कि इसका आयरन लेवल कितना है. If the child has a good iron level, his brain development will be good. He will earn better. If his iron level is low, he will not be good in class. He will not good in college, and he will not get a proper job, a well-earning job. This all can be calculated just with iron.
No, I think very, very insightful, meaningful conversations, and the conversations we are having right now, I think these are, leading us to good times, that we are at least becoming aware. Like a lot of information you guys shared today was a news to me. I was, though I'm being in in the influencer space, I talk to so many experts, but I was not knowing these alarming numbers. And I also feel now that mothers, when they've heard us out, they have come to know how to prevent IDA. They all want to know हमारे बच्चे का स्कोर कितना है, what's my child's iron score, क्या मेरा बच्चा उन 10 में से 7 में है या वो 3 में है. I'm sure mothers, you are very keen to know. I was very excited जब मैंने प्री बस देखा तो मुझे सबसे पहले लगा कि let me know about my twin boys. And sir, I'll share it with you. Last evening I asked them to go through our assessment. Mothers, there is a pink link here for you. There's a pink assessment which is available to all of you. You can just click on the link and take that assessment and understand कि हमारा child risk पे है कि नहीं. And you can you can have your children, if they're grown up, to give their answers on their own, so that they also understand what doctors were talking about, that they also become a little aware कि हमारी eating habits right है कि नहीं, what we are doing is right or not. So I think this pink assessment is a must. Mothers, go for it, because both my boys, sir, unfortunately fall into iron deficiency anemia, and I was literally taken aback. And today's live is more personal to me now, because I'm also speaking like a mother to both of you. My last question to both of you is, it was a wonderful and insightful conversation, and I personally feel that you have contributed so much that people who will be watching this live will have so much to take away. What's your last golden nugget or a takeaway message to all our viewers? We'll go with Dr. Dutt first, and then we close with Dr. Sethi.
So never think that if I am from a good socioeconomic status, I'm living in a city, and I'm taking care of all my children, that my child cannot be iron deficient. There are so many factors. If like out of 10, 7 are iron deficient, irrespective of where you are living in India. So it is very important. 70% chance है कि anemic है already. 99%, 95% chances child is already iron deficient. So look for the danger signs. Even before you look for the danger signs, start a good, healthy, iron-rich diet. And the good part is, whenever you're giving an iron-rich diet, it has all the other micronutrients also. If you're giving legumes, if you're giving spinach, if you're giving broccoli, if you're giving good home-cooked food, it is not only iron. Usme vitamin D bhi hai, zinc bhi hai, folate bhi hai. All these things are there. You're taking care of not only iron deficiency, you're taking care of all the other micronutrients also. As Sir had said, having a cheat day or a reward day would be very good. For older kids, have a day every weekend, every 10 days, when going out, eating good food. Make it a reward, but not a daily thing. Be the role model. The parent should be role model. It should be not be like a cold drink is always lying in the house. We are also drinking cold drinks and we are saying child cannot have cold drink. We are on the phone all the time and child starts taking phone. Parents complain, why is the child on phone? It's always be the role model. Switch off your phone while you're in front of the child. Play with the child. Teach the child about good eating habits. They become core value. If the child who is like 5 years, 10 years now has good eating habits, they are solidified. They will remain good eating habits forever. If you have a child who has developed bad eating habits, it's very difficult for them to change. For an adult to say कि आप ये मीठा खाना बंद कर दो, ये बंद कर दो, it's very difficult, because these are core habits has become. Second, again, it's very important not to only think of iron deficiency. Diabetes is becoming a big problem. As the children are growing up, young onset diabetes, adult diabetes, India is going to become very soon the #1 country with having #1 diabetics in the world. So we need to reduce the sugar consumption very early in the childhood, so that the habit of eating sugar is not there. And if we have all these core values, a good eating habit, we can prevent iron deficiency anemia. But again, be very watchful. There are other things like infections, worm infestations, they can lead to iron deficiency anemia. The moment you think the child is iron deficiency anemia, do contact your doctor, and we will be easily able to identify whether it is iron deficiency anemia or not, even whether it is just iron deficiency or not, and recommend the right iron to be taken. Again, it's very important. In the market, there are a lot of fancy irons available with the exotic preparations. Their absorption is not exactly per se. We know that ferric ascorbate has a very good iron absorption, and even though it can cause darkening of stools, it is the only iron which has been recommended worldwide, not some fancy preparation.
Okay. I think I really liked one line what you used, that we are the role models of our children. Of course, they don't listen to you, but they observe you, and whatever you are doing, they are bound to replicate it. So from early days, if we inculcate right eating habits in the household, I'm sure our kids are in a better place. Dr. Sethi, your closing notes, sir.
Well, I will put it in another way, that the child and the mother is one unit. It's a unit. And until and unless you have the proper health of a mother, the child's health is not going to be good, So first thing first, that the pregnant woman has to have good nutrition, because unless the nutrition of the mother is good, it is not going to traverse the placenta and to the fetus, and the fetus is going to be low birth weight and maybe even preterm, or may have so many other problems. So the first thing is
Yeah.
that you have to look for the health of the mother. Second thing, as we have already discussed, is that exclusive breastfeeding is to be given because it is meeting the demands of the child's growth till about 6 months of age. But thereafter, as we've already said, complementary feeding are the most important thing to prevent anemia, because you add on to so many things. We add on to cereals, to vegetables, to fruits, and so on and so forth. So complementary feeding is very important, because that's the time when iron deficiency anemia sets in, and if that is not looked after, you're leading to havoc. So, and then of course, as we discussed, that cow's milk should not be introduced early in infancy, because that's going to hamper the absorption of the iron otherwise, and again give rise to iron-deficiency anemia. So these are certain things which I think should be put forth to the mothers, that their health is important, and thereafter the health of the child is important afterwards.
What a beautiful nugget, and I think you summarize all the entire conversation in your nugget. I think that was very wonderfully. Thank you, Dr. Sethi. Let me first start by thanking Dr. Sethi and Dr. Dutt to be with us this evening. I know that you guys have your own busy commitment days, but still you have taken out time to be with our mothers. Thank you, sirs, for being with us. And I'm sure all the viewers who are watching us right now on Unimo Universe Moms page and Pink of Health page, I hope you found this live very insightful, because I personally, as a mother, have taken a lot of notes here. And I personally feel that you all should also learn a lot from this live and take action on it. Also, share this live in your network, because we don't know who might want to see a conversation like this, who might have missed on it. And I would again, close this live by thanking Pink of Health, the Supply Initiative, for powering this live and also bringing these amazing experts to us for this conversation. Thank you, everybody. And we are not ending it here, guys. You are gonna watch a wonderful video as we end this live by the actor and renowned, mother, Amrita Rao, who also, as a mother, believes in preventing IDA, and that's what she has been sharing in this video. So, mothers, do watch it out. Do give your comments on how do you like this film, and we'll take a leave from all of you, and with a message that stay home, stay safe, and also stay healthy now, because idea is on a rise, as doctors shared. And I think as mothers, it's our responsibility to make sure our family, our children are healthy. Yeah, thank you so much. Thank you.
Thank you so
Thank you
much.
very
Thank you.
much. Thank you very
Thank you.
much.
Yeah.
जैसे ही माँ बनी, लोगों ने बोला, अरे वाह, आपके घर में तो फ्यूचर हीरो आया है। मुझे पक्का पता है, आपके घर भी यही होता होगा। बच्चे की दुनिया में आते ही लोग डिसाइड करना शुरू करते हैं कि वो फ्यूचर में क्या बनेंगे। आपकी लड़की तो इंजीनियर बनेगी, अरे ये तो डॉक्टर बनेगा पक्का। इसको तो क्रिकेटर ही बनना है, लिख लो। और तो और आपके साथ उसके फ्यूचर प्लानिंग के बारे में भी बात करते हैं। देखो, स्पोर्ट्स में भी थोड़ा ध्यान रखना। अंग्रेजी तो बहुत अच्छी आनी चाहिए। स्कूल में ए ग्रेड तो लाना बनता है बॉस। मगर प्रेजेंट को इग्नोर करके बेबी के फ्यूचर प्लानिंग करने का क्या फायदा, जबकि उसके सपनों के पहले कदम अभी से शुरू होते हैं। मगर पता है मुझे हर वक्त क्या डर रहता है कि कहीं उसके खून में आयरन के कमी के वजह से, यानी आयरन डेफिशिएंसी अनीमिया के वजह से उसके ये कदम कमज़ोर ना पड़ जाए। इंडिया में 10 में से 7 बच्चे आयरन डेफिशिएंसी अनीमिया से पीड़ित हैं। अगर आप पेल स्किन या चौक या मिट्टी खाने की आदत या फिर पुअर कंसंट्रेशन, ऐसे कोई भी लक्षण आपके बच्चे में देखें तो इसे इग्नोर ना करें, क्योंकि हो सकता है आपके बच्चे को आयरन डेफिशिएंसी अनीमिया हो। आयरन और आयरन डेफिशिएंसी के बारे में और जानने के लिए लॉग इन करें pinkofhealth.co इस वेबसाइट पर और लीजिए आपके बच्चे के लिए पिंक असेसमेंट। और कुछ ही स्टेप्स में आपको पता चलेगा कि आपके बच्चे को आयरन डेफिशिएंसी की संभावना है या नहीं। और हाँ, डॉक्टर से राय ज़रूर लीजिएगा, क्योंकि हमारे बच्चों के लिए आयरन भी है ज़रूरी। जैसे ही माँ बनी, लोगों ने बोला, अरे वाह, आपके घर में तो फ्यूचर हीरो आया है। मुझे पक्का पता है आपके घर भी यही होता होगा। बच्चे के दुनिया में आते ही लोग डिसाइड करना शुरू करते हैं कि वो फ्यूचर में क्या बनेंगे। आपकी लड़की तो इंजीनियर बनेगी, अरे ये तो डॉक्टर बनेगा पक्का, इसको तो क्रिकेटर ही बनना है, लिख लो। और तो और आपके साथ उसके फ्यूचर प्लानिंग के बारे में भी बात करते हैं। देखो, स्पोर्ट्स में भी थोड़ा ध्यान रखना, अंग्रेजी तो बहुत अच्छी आनी चाहिए, स्कूल में ए ग्रेड तो लाना बनता है बॉस। मगर प्रेजेंट को इग्नोर करके बेबी के फ्यूचर प्लानिंग करने का क्या फायदा, जबकि उसके सपनों के पहले कदम अभी से शुरू होते हैं। मगर पता है मुझे हर वक्त क्या डर रहता है कि कहीं उसके खून में आयरन के कमी के वजह से, यानी आयरन डेफिशिएंसी अनीमिया के वजह से उसके ये कदम कमजोर ना पड़ जाए। इंडिया में 10 में से 7 बच्चे आयरन डेफिशिएंसी अनीमिया से पीड़ित हैं। अगर आप पेल स्किन या चौक या मिट्टी खाने की आदत या फिर पुअर कंसंट्रेशन, ऐसे कोई भी लक्षण आपके बच्चे में देखें तो इसे इग्नोर ना करें, क्योंकि हो सकता है आपके बच्चे को आयरन डेफिशिएंसी अनीमिया हो। आयरन और आयरन डेफिशिएंसी के बारे में और जानने के लिए लॉग इन करें pinkofhealth.co इस वेबसाइट पर और लीजिए आपके बच्चे के लिए पिंक असेसमेंट। और कुछ ही स्टेप्स में आपको पता चलेगा कि आपके बच्चे को आयरन डेफिशिएंसी की संभावना है या नहीं। और हाँ, डॉक्टर से राय ज़रूर लीजिएगा, क्योंकि हमारे बच्चों के लिए आयरन भी है ज़रूरी।